What up, what up, what up, y'all? I did promise y'all I was going to do a quick video on those breaking news, the Eli Lilly's breaking news, and I just wanted to go ahead and go over the results really quickly in this short video. As promised, obviously we'll talk about it a little bit more while we live on Sunday, but I just wanted to jump into it because it's some very exciting news about for those that are diabetic, because they've been waiting for this for a long time, and I think that this is a big one, with the Retatritide results. All right, so I'll just jump right into them. Lilly's triple agonist Retatritide successful in 2 additional phase 3 obesity trials, delivering significant improvement in weight and A1C. In Truimph 2, adults with obesity or overweight and type 2 diabetes, a population with increased difficulties losing weight, lost up to an average of 21% at 80 weeks. That's huge. Why? Because those that actually are suffer with diabetes usually generally lose around 13% on the other medications that's currently available. But with Retatritide showed losses in the same stratosphere on average as Zepbound for those without diabetes. So again, it showed on average the same weight loss for those without diabetes in this phase 3 trial. In Truimph 3, adults with severe obesity and established cardiovascular disease with or without type 2 diabetes lost up to an average of 23% at 80 weeks. That's huge because those are people that have severe obesity and have heart disease, right? So now we know in the earlier trial that people actually lost about 30%, but those were individuals that had severe obesity but did not have cardiovascular disease, right? So across 5 positive phase 3 studies, Retatritide has shown powerful efficacy, and they believe it could be an important future tool in the management of cardiometabolic health. So with positive results from Truimph 2 and 3, they now have the clinical data package to support global submission for Retatritide as a potential treatment for obesity, knee arthritis pain, and obstructive sleep apnea. So this is huge because, that means that I also feel like they're probably going to go and submit that FDA approval, and you'll probably see Retatritide at the top of next year, okay? So in Truimph 2, all 3 study doses of Retatritide, 4, 9, and 12 milligram, delivered substantial weight loss and improved glycemic control at 80 weeks in adults with type 2 diabetes and obesity or overweight. Participants taking Retatritide 4, 9, and 12 milligram lost an average of 13% on the 13%, 19%, and 21%. Respectively, alongside A1C reductions and up to an average of 1.6%. So even with the glucagon factor, they still actually saw a reduction in A1C, because we know that glucagon is what raises the that's what actually has the potential to raise that glycemic index. In Truimph 3, both study doses of Retatritide, 9 and 12 milligram, delivered substantial weight loss in adults with severe obesity and established cardiovascular disease with or without type 2 diabetes. Participants lost up to an average of 22% at 80 weeks. So in the study, those with MACE. So MACE stands for Major Adverse Cardiovascular Events. So those with MACE occurred less frequently than anticipated in both Retatritide and placebo arms. In pre-specified analysis for time to first occurrence of MACE, there were 44 MACE, 5, which is all-cause death, heart attack, stroke, heart failure events, or coronary revascularization events observed in patients randomized to Retatritide. They pooled between 9 and 12. 52 events observed in those randomized to placebo, resulting in a hazard ratio of 0.82, right? So there were 27 MACE-3 events, which is cardiovascular death, heart attack, or stroke events in participants randomized to Retatritide, and 23 in those randomized placebo, resulting in a hazard ratio of just 1.12%. In Truimph 3, Retatritide meaningfully reduced certain cardiovascular risk factors, with the highest dose delivering average reductions of 37% in triglycerides, 16.5% in non-HDL cholesterol, 9.3% reduction in systolic blood pressure, and 7.5 inches or 19 centimeters in waist circumference, and 51% in high sensitivity C-reactive protein. So these are amazing results for these particular trials, and I think that is very exciting because we have a lot of people that are actually, diabetic, who actually have been waiting on something like this to actually see meaningful weight loss. And we all know that they were tolerated pretty well, so that's actually a thing. So we'll dive in a little bit more on this coming Sunday, but I just wanted to really highlight that those that are diabetic on this particular medication are able to see 22% of their actual weight loss that others are seeing on Zepbound that are non-diabetic. And I have been saying that. Now, obviously, this is an average, but Zepbound's also an average, right? But I have been saying this to one of our actual subscribers and close friends, and we were going, kind of back and forth, and that person knows who they are. I won't say their name, but we were talking about, diabetics actually seeing that actual percentage weight loss. And lo and behold, in this study, it shows that they actually got it. They got the same average that those that are taking Zepbound, like myself, got, even being diabetic, on the 9 and the 12 milligram of Retatritide. So they do have an option. Now, whether they use it or not, that's up to them. But the option is coming to where they can actually get that same amount of weight loss. And the exciting part about that is that they actually going to see more metabolic benefit with their other numbers, most likely because of this also. So there's that. I wanted to jump in, and like I said, because I promised, I said I would jump in and do a quick video on via my short earlier today. So this was that. I'm going to actually get this posted so people can actually see it. This is me just jumping in and kind of like going over everything without all the fluff, so you guys know what that looked like. And that Truimph 3, where it was severe obesity with the cardiovascular, where severe obesity was defined primarily as clinically obese, which is 40 or more. But in the trial, there actually were people that were at 35 or at least 35, equal to 35 or more in these trials, because class 2 and 3 obesity are 35 and 40% respectively. So me personally, like a lot of people know, when I actually started my actual journey, my BMI was right around 42.5, almost 43%. So I would be classified as that in that severe clinical obesity. And I have reduced my BMI from 42.5, 43, all the way down to 29. So, seeing these numbers and knowing that individuals, with these other comorbidities like the cardiovascular disease and the diabetes can actually have an opportunity to possibly, remove themselves from obesity is, absolutely amazing. And I think people should really sit with this and understand that it is a very, very big deal. Obviously, the other side of it is insurance and being able to, secure meds based on pricing, and knowing that it could possibly be classified as biologic is also why you see them, trying in doing these trials, so that way it can be there are other things that these things can be approved for, like the MACE, that those with that heart disease, and those that have diabetes and things of that nature, and all of the other things, the knee pain, and the lower back pain, and all of the things, and sleep apnea, because they want people to actually be approved by their providers, for these things. So there's that. I'm gonna bid you guys adieu for tonight. So like I always like to end all my videos, obesity warriors, stand up. We're in this together. Later. See you guys Sunday, 8:30, 9 o'clock.